My name is Mignon Lewis, and I'm the director of the Triple Aim for Populations Focus Area at the Institute for Healthcare Improvement. And our goal is to improve health and healthcare worldwide. We're a global nonprofit, and our ultimate mission is to accelerate improvement around the world in health and healthcare by being a partner with organizations that are looking to accelerate improvement, being an innovator of new ideas that can spread quickly and get into the hands of the health and healthcare workforce to actually improve the delivery of the services that they have for their populations, to be a driver of results and to really inspire results in others. So Signature has been a participant in IHI's Triple Aim Improvement Community, which was a 2-year collaborative, a Breakthrough Series collaborative, of about 41 sites around the world. There were healthcare systems, there were standalone hospitals, public health departments, business coalitions, and broader community coalitions, lots of different entities and organizations and governments around the world that came together to work on the Triple Aim. They were one of our healthcare systems that were involved, thinking about how do you actually redesign the services of the populations that you serve, using the Triple Aim as the framework to guide it. And really taking on how do you build the infrastructure to work on the Triple Aim within your organization. What does leadership and governance look like for the Triple Aim? How do you build a whole portfolio of projects and investments to move some key system level measures for the population that you hold yourself responsible for? And then executing on that portfolio and actually trying to take that portfolio of work to scale for your population. So they were one of the sites. We had a fantastic time working with Signature. They were one of the ones that sort of pushed the envelope and really got big results in just 1 to 2 years. So we're really proud of their involvement. When I think about the work of the Signature team in comparison to some of the other organizations we've worked with, the amount of quick results was demonstrable. And if you talk to the team, their ability to reduce acute admissions to the hospital, to reduce ED utilization, to move the actual care to the right time, right place, and make it better for the patients. We saw far and away sort of the Signature team sort of run faster, do more. I'm really proud of the work that the Signature team has done. Congratulations for the great work.
Alan Frankel. I'm one of the principals in a company called Safe and Reliable Healthcare. Our mission is to help organizations achieve safe and reliable operational excellence through improving leadership, teamwork, improvement skills. The company was asked by a commission downtown, the Health Policy Commission, to evaluate 29 hospitals across the state of Massachusetts. We've been involved in evaluations of organizations from, quite frankly, Singapore to the western part of Canada. So our engagement with Signature Brockton started as a result of the request by the Health Policy Commission. Signature Brockton was one of the ones I was lucky enough to come down to visit. So in the last decade, I'd say since about 2000 or so, the conversation in hospitals and in healthcare systems has been around the cultural determinants or the cultural underpinnings that create environments of learning that then lead to greater reliability. Signature Brockton has challenges even greater than many of the institutions that I visited around Massachusetts because of the population that Brockton takes care of. You're almost like an inner city hospital, but out in the Brockton area with enormous challenges delivering effective care to your population. What was striking in going into the Signature Brockton Hospital, as I think about and compare the other institutions, is the focus, the determination to deliver really excellent care, the willingness to manage scarce resources and to think about how to use those as effectively as possible. Amongst the institutions we were looking at, Signature Brockton was truly outstanding. I had this opportunity to interview, a number of hundred of people in Signature Brockton, and in each of the conversations, you would hear this focus and this determination to create an entity that was going to be safe in the way that it delivered care, where the goal is to do that reliably, and where the focus is clear from the front line all the way up to the senior leadership. And listening to Kim talk about how he's achieved this is, as I listen to his description of it, I now talk about that when I go to other institutions. I get to kick the tires on a lot of hospitals and healthcare systems. There is something special going on at Signature Brockton that for me was really exciting to see.